You are most welcome to this video. Now, I'm going to make public a consultation between me and my consultant cardiologist, Dr. Aseem Malhotra. This interview is purely about me. You cannot take any medical advice from this whatsoever. You must consult your own doctor, but I present this for educational and entertainment purposes only. But the data on it is genuinely my medical information that I've decided to make public for educational purposes. Well, welcome to this video, and it's actually a medical consultation for me, so it's not really a video, it's just me and Dr. Malhotra having a chat, given that there's no one else watching. So I'm a bit concerned, Aseem, at the moment. I've got these blood results from my doctor.
Yeah.
And my cholesterol's a bit high. So the normal range is 2.5 to 6 and mine is 7.1.
Right.
And the doctor said I should take these.
Right.
Statin, 40 milligrams a day.
Yeah.
Now you're a consultant cardiologist. You've got a special interest in metabolic health.
Yeah.
And you've got a long history of being exonerated. We could go through the list now, maybe later. But for now, if you want to be my doctor, I would really appreciate it. Should I be taking these statins, Aseem? I really don't know what to do. I'm confused.
Yeah. So, John, very interesting. So there's two different ways of approaching this, and we'll cover both. The first thing is looking at statins in terms of their use and their benefits. And for a long time, and still a lot of people think that the benefits of statins are because of lowering cholesterol. But we know that isn't true, because I published a review in 2020 in BMJ Evidence-Based Medicine, where we showed that looking at all different cholesterol-lowering drugs, including statins, there was no clear relationship with cholesterol lowering, specifically LDL lowering, the so-called bad cholesterol, we'll get onto that, and preventing heart attacks and strokes. Statins do have a small benefit, though, through a different mechanism, John, which is they are anti-inflammatory and anti-clotting. Okay, this is before we get to the side effect issue. So the next question is, and this is where we have this discussion, John, is if you are at low risk of having a heart attack or stroke in the next 10 years, and I'm presuming your blood pressure is normal.
Yeah, normally my blood pressure is about 120. It depends. If I take it at home when I'm relaxed, it's normally fine. It's normally about 125 over about 78-ish, something like that.
So it's in the normal range. You're not pre-diabetic or diabetic.
No, my HbA1c is actually okay. That's in a normal range. My long-term sugar test is normal.
Fine, great. And you're not a smoker?
Oh, heck no.
No. And John, how old are you, if you don't mind me asking?
67.
Okay, that's all very interesting. So you will be you will be in the low risk of having a heart attack or stroke in the next 10 years. Okay?
Oh, that's great, Aseem. Thanks. That's
all right.
Good to know, yeah.
And what that means is, John, that your benefit of a statin at best over a 5-year period, at best, because this information is curated by the drug industry, it gives you a 1% chance of a statin, if you took it religiously, preventing you from having a heart attack or stroke, but without prolonging your life by 1 day. That's if you don't get side effects. Now, John, I've given you that information as it is. If I told you that there's a 1% chance it will benefit you if you don't get side effects, is that a drug you'd like to take?
Well, it's not going to increase my chances of living longer, which is really the one of the key indicators. Sure. I've got so much left to do. So if it's going to reduce my chances of a heart attack by 1% if I take this every day for the next 5 years, but make no difference unto my life expectancy, then I think I might leave that one actually for now.
Listen, John, your reaction is not unusual. In fact, they've done studies that, given that information presented in a transparent, honest way, most patients with a 1% benefit wouldn't take the pill. So you're not unusual at all. And I support your decision in keeping with what we call the principles of ethical evidence-based medical practice.
Yeah.
So that's the first thing to say. Now, the other interesting part of it all is, how high is your LDL? What's your LDL at?
Well, my LDL, low-density lipoprotein, was, it says serum LDL 4.3.
Okay. So LDL is the one where you often patients get a red flag if it's above 3 millimoles from their GP.
Yeah.
But what's really interesting is if you're over 60, all right, I found through research published in BMJ Open in 2016 with a number of international scientists, if you're over 61, there is no association with LDL cholesterol and heart disease. So LDL does not have any association with developing heart disease in the future. And the other interesting finding, John, was there was an inverse association with LDL and all-cause mortality. In other words, the higher your LDL statistically, if you're over 60, the less likely you are to die, probably because cholesterol has a very important role in the immune system. And older people are more vulnerable to getting infections and dying from infections. So there is nothing to worry about. So I'm absolutely would advise you that there is no reason for you to lower your LDL at all, because we know it doesn't prevent heart attacks and strokes on its own, and actually it may be protecting you. So I would leave your LDL as it is. But we talked about metabolic health, and the one thing that one of the markers of metabolic health is your triglycerides. Well, two of them are triglycerides and HDL. So what's your HDL and triglycerides?
My HDL was 1.2 on the last test.
Okay, fine. So above 1 essentially is normal. That's fine. And triglycerides?
My triglycerides were 3.6.
Okay. And was that fasted or non-fasted?
That was non-fasting.
Okay. So it isn't the most accurate. If you're getting a cholesterol level checked, it's really important you get it done fasted. If it's fasted, we want it to be less than 1.7. Okay.
What, the triglycerides?
Triglycerides. And that is a marker of one of the markers of metabolic health not being fully, normal. So that now, if it was above 1.7, John, and it may not be because it was done non-fasted, but let's say it was above 1.7, what I would advise you to do, interestingly, for the easiest way to get triglycerides down, which again is the triglycerides is certainly a risk factor for heart disease. Is actually just cutting out the sugar and starchy carbohydrates, which I know is not easy for everyone to do, but that is the most dramatic way and the quickest way. And that would go down within a few weeks of just quitting sugar and starch.
Really?
You've seen the triglycerides drop, yeah.
How low would I have to cut my carbohydrates to achieve that?
Well, listen, everyone's different. What I advise my patients is for the first, 4 to 6 weeks, if you like, go cold turkey completely on the starch and the sugar. So that means no bread, no pasta, no potatoes, no rice, no fruit juice, no sort of added sugar, just to see what impact that has on your triglycerides. And then you can then see what your baseline is and then adjust accordingly. And this isn't forever. I tell patients then do the 80-20 rule. 80% of the time follow the diet, 20%, you can have a pizza and a biryani the weekend.
Have a pizza.
Like I do. But at least you kind of just, you can see what the ultimate benefit is by going a bit more extreme. And of course, I advocate for a low-carb Mediterranean diet for heart disease risk. And that means extra virgin olive oil, nuts and seeds, whole fruit and vegetables, oily fish a couple of times a week. And I'm not bothered if you want to have steak. You can have steak as much as you like, or you can have eggs and bacon or a fry up in the morning, as long as it's cooked in butter and you don't have any toast. That's fine. So that's what I tell patients, and they're like, "Oh, that sounds like that. I think I can cope with that." And there's no counting calories as well. And the results, John, generally I find with my patients are very quick. They notice benefits within a few weeks, not just in terms of blood markers, but quality of life. They lose a bit of weight, their belly fat. They find their energy levels are better. They're thinking better. They're sleeping better. It's really, really amazing.
So basically you're saying I can feel a lot better, think clearer, sleep better just by cutting down on refined carbohydrates and carbohydrates as much as I can.
Yeah, absolutely.
Right, amazing, yeah.
But you notice those benefits. Like it's a big change for a lot of people. We're addicted. We're actually addicted to sugar and carbs. And by the way,
I am completely.
Mate,
yeah,
I have full empathy with you. I was the same, like really hardcore. Up until my early 30s, I was eating 40 teaspoons of sugar a day in different foods. It was typically a panini for lunch. It was pasta for dinner. It was cereal for breakfast. I was proper carb and sugar addicted. But when I went cold turkey, my palate changed. I don't crave it anymore. I have it occasionally. I don't really crave sugar anymore. So, it's a big change. But, definitely I'm 46 now. I recently had a test done for my metabolic health age, and it came back at 31. So, it's I'm happy with that.
How long did it take to get over the craving? Take you to get over the cravings?
For men and women, it does tend to vary, but for most people, you notice it takes about 2 to 3 weeks to break the addiction. And then when you get through the first 2 to 3 weeks, the palate changes and the cravings start to go. For women, for whatever reason, it can take longer. It can take 6 weeks. It can take a lot longer. But the most important thing is to avoid sweeteners and go completely cold turkey. You want to unsweeten your sweet tooth.
Yes, absolutely.
And people ask about fruit, just very briefly. Avoid the high sugar fruits. So the things that you can eat are things like berries, strawberries, blueberries, blackberries, raspberries. Those are the things I advise people to do in the first instance. Avoid things like banana, mango initially. An apple's probably all right. A pear's probably all right because it's high fiber. but generally avoid the high sugar fruits as well.
Right, I can try and do that. Can I have a tipple on the Friday night?
Yeah, mate, listen, my part of my diet plan, I said if you want to have a glass of red wine with this, it's absolutely fine. So, yeah, no issue there. I think do one thing at a time. But yeah, if you want to have a bit of some alcohol, absolutely, mate, no problem. Keep it within the recommended limits.
Absolutely. I'm not drinking at all at the moment, but it's nice to have the option. But beer presumably is a bit of a no-no, is it? With a high carb.
Beer is usually quite high in starch, you see, in terms of as in it's carby beer.
Yeah.
So beer certainly, while you're doing the initial 3 to 6 weeks phase, I would say avoid beer. Red wine's probably your go-to drink, or maybe, a little bit of spirits as well, no issue. Maybe tequila, a bit of whiskey, but red wine is the only one that has some evidence base behind it being potentially beneficial for the heart and the mind.
And it also tastes
but with
nice
meals
in moderate amounts. Yeah.
Yeah, and also with meals, not an empty stomach like they do in the Mediterranean. It may be the synergy of the extra virgin olive oil, the oily fish, the vegetables, and the glass of red wine together probably has a potent anti-inflammatory effect on your body.
Yep. And just in case anyone is listening to our private medical consultation, don't start drinking based on anything you do. This is if people drink already. Do not start for the benefit of your health. If you drink already, modify it in the way that seems just specified. This is a bit depressing in a sense, Asim, because I've spent 30 years teaching that HDL is good and LDL is bad. And now you've just told me that LDL, low density lipoprotein, actually, if that's higher, you actually live longer.
Yeah, especially if you're older. And even they did a study at the BMJ a few years after the ones we did in Denmark, looking at people aged between 20 and 100,000 patient observational study, I think over 10 years, looking at what was the optimal level of LDL for longevity. And it came back at 3.6 millimoles per litre for all comers, John. So this isn't just people over 60. So for me, as long as it's less than 4.9, 4.9 is a cutoff where you start thinking they could have familial hyperlipidemia, and that's a genetic condition that affects 1 in 250 people and is strongly associated with premature heart disease. However, once you correct for triglycerides and HDL, and they're in the normal range, LDL generally it doesn't have any risk associated with it, and that's really one of the biggest scandals and cons I think that is being perpetuated on doctors and the public for decades, based upon flawed science, exploited by industry interests. Statins are $1 trillion industry. Cholesterol-lowering drugs are new ones, just as much, getting to that level because they're more expensive. And big pharma want to get people on as many pills as possible. And we've got to accept and understand that they are pathologically self-interested when it comes to making money. So they will create deception for money. They're not benign entities. They are the complete opposite. They are psychopathic entities, not the people that work for the companies, but the system. And that's what we have to fight back against for the purpose of people's health. And of course, John, as you know, I've been involved in this sort of controversy over statins going back till 2013 when I published in the BMJ, and then carried on publishing stuff, even though we got pushback and threats of retraction and going on trial and winning all of that stuff. And only a couple of days ago, the Mail on Sunday lost a case that was brought against them for libel from Zoe Harcombe and Malcolm Kendrick. I was one of the people named in this very defamatory article saying a place belongs in health for doctors to say statins don't work. And the case was won. Yeah, the case was won. I didn't sue. My mum had just died. I thought it wasn't worth me doing that. I carried on the campaign on statins, which I have been doing. Malcolm and Zoe obviously weren't allowed to speak about it, but I'm at least allowed to carry on talking about that. But unfortunately, it is what it is. I lost my NHS job because of it. I wasn't allowed back in the NHS. I was getting smeared on social media purely based upon the fact that I lost my job because of the statin stuff, which we've now been exonerated from. So we've got to take the hits. It's not nice, but the truth is the truth. We're here, we're fighting strong, and we're here to help patients get better.
But I mean, in addition to your public health campaigning role, you still are a practicing clinician. You see patients and
I am, absolutely.
Just advise me.
John, I'm one of the most passionate advocates for NHS, and I believe that systems should be, healthcare should be free for all, but it should be comprehensive and it should be good quality. The NHS has been deteriorated because it's had corporate interference, not because it's a publicly funded system, because it's had corporate interference.
Yep.
But to keep a living, John, I had to reluctantly go into private practice. Sure. But all my advocacy and work is to help save the NHS. I carry on doing that, and hopefully at some point I'll get back in. Hopefully after this exoneration, there'll be more sympathetic within cardiology departments to let me back in and work there, because My clinical work was impeccable. I got on with my colleagues, and most cardiologists, interestingly, are sympathetic. That I think that, a month later after this article, I got told my services were no longer required, even though my work was impeccable, my patient feedback was impeccable. I got on well with my colleagues. They all know that, but this is what happens. This. And
you were a consultant at that. You were working as a consultant cardiologist at that time.
I was, absolutely.
Yeah. Yeah. Well, it's good to know that you are still seeing patients and are still obviously bang up to date. So I've got the message loud and clear on my getting my triglycerides down, this fat in the blood down with lowering the carbohydrate. So cutting out the carbs is going to help me get it down. Is there anything I can do? Is there anything I can eat to make it go down further, or does exercise help or anything like that?
Yeah, exercise probably has a minimal role to play, John. Honestly, it's really the diet that has the biggest impact on triglycerides in my experience. The other thing as well, if you're a boozer, I know you're not a heavy boozer, but there are people watching that may well be. If you're consuming, say, more than 30, 40 units of alcohol per week, then that will increase your triglycerides as well. And that's something you need to look into cutting down if that's the case.
Yep. Right, so I'm going to have to rewrite my lesson notes. Low density lipoprotein is not bad. It's going to help me, especially as the years go by. So that's really good. And any other general things I should be doing? So we're looking at a Mediterranean type diet, cutting down the carbs, getting enough exercise.
Yeah, I mean, one of the other things that we obviously point out, I know we've talked about this before, which comes out in the film First Do No Farm, is there is definitely certainly with people with heart disease, there is evidence of reversal of heart disease, and the best evidence it does suggest that stress reduction, John. So breath work, meditation, anything that you can do to relax yourself for 20 to 40 minutes a day deeply is going to be really beneficial. One of the great sayings of a doctor called Dean Ornish in America is it takes more to reverse disease than it does to prevent it. But actually, if you're in a state already low risk, then you don't have to go super extreme. But I'd start thinking about, breath work or meditation, maybe doing that for 20 minutes a day. Listen, I follow my own advice, John. I've got, as a lot of people know, I have a lot of external stress going on in my life with this advocacy work. But I do I wake up every morning and do 40 minutes of breath work first thing in the morning when I wake up.
Excellent. It sounds brilliant. I mean, this disease where the arteries fur up, this atherosclerosis, can affect the coronary arteries, can affect the cerebral arteries. I mean, can it be reversed if someone's already got moderate atherosclerosis or even advanced atherosclerosis, say even to the point where they were getting angina, the chest pain on effort? I mean, is it conceivable that this can be reversed? Or
absolutely, John. Absolutely, John. And I've seen it with some of my own patients. At the very least, when you implement this sort of complete lifestyle plan with a low-carb Mediterranean diet, with moderate activity, with stress reduction, at the very least, John, it will stabilize the situation. If it's stabilized, it's great. You're not going to, much less likely to have a heart attack. It's going to improve your lifespan and your quality of life. The reversal stuff there is some evidence from that, and it comes from India. And it does seem to be the most important factor, does seem to be almost not just meditation, but it's a change of mindset, reducing anger, reassessing your relationships, all the things that are going to increase your stress you need to eliminate or reduce in your life. That probably is going to have a big role to play. And the reason for that is chronic stress is it produces clotting factors and it causes low-grade inflammation, chronic inflammation. Heart disease is now accepted to be a chronic inflammatory condition that is not fixed and therefore can be reversible when you reduce the inflammation, which is worsened by insulin resistance, which is, again, those metabolic risk factors, blood pressure, blood sugar, waist circumference, triglycerides, HDL. But the most impactful and quickest and most dramatic way to improve insulin resistance and reduce your risk of heart disease is really through dietary changes. And from the other things to add in, John, good quality extra virgin olive oil, anti-inflammatory, nuts and seeds, oily fish, whole fruit and vegetables. As simple as that.
I'm also taking flaxseed. I've been reading evidence that flaxseed can help to lower blood pressure, so I thought that might.
Yeah, there is at least one randomized controlled trial showing that it reduced systolic and diastolic blood pressure by, I think, 20 millimeters of mercury and 7 millimeters.
Yeah, it was quite significant. Yeah, I mean, my blood pressure's okay, but I thought, why not a bit? And I think it's good for the microbiome as well. It's good.
Absolutely. Well, also, the low-carb Mediterranean diet will also help these risk factors. I get patients coming off their blood pressure pills, getting their blood pressure normalized. Their pre-diabetes or type 2 diabetes becomes normal. And this can happen within weeks. It's pretty extraordinary stuff. So, this is what we need going forward.
It really is. And the idea that it can actually reverse this, because this is a new idea. I didn't really, I think the conventional teaching was once the fatty plaques were there, you really couldn't reverse it. And the best you could hope for was to give statins as an anti-inflammatory to stabilize the roof of the plaques and stop the plaque stop de-roofing of the plaque that lets the atherogenic or the clotting part of the core inside the procoagulation part of the core inside the plaque coming into contact with the blood. I mean, is there still a indication for statins there in people with more advanced atherosclerosis that it stabilizes the plaques?
I'm glad you've raised that point, John. So the benefits of the statins do get better if you have had a heart attack already, or you've been diagnosed with severe blockages, or you've had a stent.
Right.
And that benefit is 1 in 39 over 5 years in preventing a further heart attack.
That's better. I'd probably go for that, yeah.
Yeah, and 1 in 83 for prolonging your life. Now, most patients probably decide they'll take those chances, but I have a great case study again, which is fascinating, which we bring up. Sorry, another plug here for First Dinner Farm. Tony Royal, who was actually an international airline pilot, had a heart attack. He's in his early 50s after flying, luckily not when he was flying, went to his GP, had a heart stent, got put on loads of meds. He's a clever guy. He's a maths and physics teacher. Started getting side effects, weaned himself off the meds himself, went on a low-carb diet, transformed his life. He's off all his meds. And he's now training for World Ironman, and he's in his early 60s. It's an extraordinary story, which again, people can see and learn about in the film. But he decided. I mean, he understands the stats himself, and it's about personal preference. You give patients information, and he said, "Listen, doc, I'm a statistician. I'm a maths teacher. 1 in 39 isn't good enough for me. I'm doing alternatives. I feel great. I'll leave off it." And I said, "Listen, Tony, that's fine. I support your decision."
Excellent. Right, I'm gonna definitely take your advice on board. Thank you for that. It's a brilliant consultation. Of course, this was a consultation for me. Obviously, these things are individualised, and you have to see your own medical provider. But it's great that getting that advice from you really is really nice, because I know you've worked on this tirelessly. In fact, we could maybe mention that. I mean, you flagged up this whole thing about metabolic health a long time ago.
Yeah.
And then you flagged up the risk from pharmaceutical interventions again a long time. Some pharmaceutical interventions, overuse of pharmaceuticals. We're not saying drugs are bad by any means. They can be life-saving, of course.
Of course.
But it seems to me you've been exonerated on the diet thing. As the more evidence that's come to light, the more your opinion has been substantiated. The overuse of medication, well, we've just discussed it in my case as a single example, but and the film, whatever you do, see this film First Do No Farm, because that brings it out really, really quite startlingly well. And I think you've actually been exonerated already on the fears that you have about the mRNA vaccine injuries. The evidence for the adverse effects of these genetic vaccines, I would say, is now overwhelming. So it seems to me that you've been thinking ahead of the curve, and it's great that you've chosen to share some of that with us. So thank you for that. We appreciate that. And I know many thousands of people watching also appreciate it.